Hello everyone, my name is Muhtadi Al and today I'm gonna talk about the neuroradiology from the textbook of First Aid Radiology for Wards. Okay, so in this first video I'm gonna talk about the imaging modalities including CT language, CT with contrast, without contrast, and how to present CT scan of the head. Okay, let's get started. The imaging modalities. There are four main imaging modalities used to evaluate the head. We have the computed tomography with contrast and without contrast, and we have the MRI with IV contrast, and we have the MRI without IV contrast. So we don't have X-ray because, well, the X-ray, you're just going to see the skull, so it's not interesting for us because we are talking about neuroradiology. Okay, so the CT language. Increased whiteness on a CT scan is referred to as hyperdense or high attenuation. Causes of hyperdensities include the following. So either you have calcification, acute hemorrhage, or ossification, or contrast. Okay, so these are going to look hyperdense. They are going to look white because calcification and all the hemorrhage and the ossification, which is, by the way, it's the same as like the calcification. All these things, all these four things have high Z material. The substance has a high molecular weight, which makes it white on ionizing radiation. Okay, increased darkness on CT scan is referred to as hypodense or low attenuation. Causes of hypodensities include the following. We have either air or fat. Okay, but note that the air appears darker than the fat on CT scan. So this is a good way to differentiate between air and fat on the CT scan, which will be helpful for us. Okay, CT without contrast. When do we order it? This is usually the first test performed in an emergency setting. It's excellent at identifying blood because the blood will look white, and it will differ. The advantages. If patient is stable, there is relatively no contraindications for ordering this test. It is a fast exam that can be completed in seconds. Disadvantages, however, due to bony artifacts, it is difficult to visualize abnormalities in the posterior fossa and the brainstem. However, for this, we can use something else. We can use the MRI if we want to visualize the posterior fossa or the brainstem. All right, let's continue. CT with contrast. When to order it? If no abnormality is seen without a contrast, then a scan with contrast could be ordered to see if there is an identifiable pathology. Contrast will help to identify tumor, abscess, and AV malformation, arteriovenous malformation, and aneurysms. Okay, what about the advantages? It is a lesion enhances, if a lesion enhances with contrast, then the blood-brain barrier is compromised. This can be seen in tumors, abscesses, and arteriovenous malformations, in which we have the blood-brain barrier compromised. The disadvantages, however, contrast will obscure an acute bleed. Thus, in an emergency setting, it is important to obtain a CT without contrast first. Okay, so how to present a CT scan of the head? And we're gonna talk when you're gonna see the first picture here, and we are gonna explain it. First, confirm the CT belongs to your patient, obviously. If possible, compare to a prior film if he has. Then present in a systematic manner. How do we do that? First, we check the technique with or without IV contrast. Second, we see what acute findings do we have. Do we have blood, which looks white or bright white? And we check the cisterns. This is very important. Check the 4 key cisterns for blood or effacement. Okay. Mesencephalic and suprasellar star-shaped, and cryotrigeminal and Sylvian. Then we check the brain. Check for symmetry. So the brain should be symmetrical. Low and high attenuation, midline shift, loss of gray-white differentiation. These are important points. Then we check for the ventricle, obviously. So we check for the lateral, third and fourth ventricles for blood, because of course the blood gonna accumulate in the ventricles, and we check for a shift in the midline or effacement. Okay, the next point is we check for the bone. Look for the adjacent soft tissue swelling and underlying fractures, which we'll talk about it next time. We're going to talk about linear and depressed fractures. Okay, so let's see. We have a sample CT presentation. This is a non-contrast axial CT of Mr. Smith. There is an acute subdural hematoma along the left hemisphere, causing effacement of the cisterns and left to right midline shift. There is associated soft tissue swelling. No evidence of an underlying fracture. Let's see the CT scan. So here we have the first picture on the left side. On this picture, we're going to start, and we can see this is a CT scan without contrast, and we are going to check it. So first, we're gonna need to know which level of the CT scan is that, because we know that the CT scan does a lot of slices through the skull. A lot of slices of radiation passes through the skull and form for us this picture. So we need to know which level this is, and to know that, we need to identify the structures. So first, we can see here, this thing is what is the caribriform plate of ethmoid, and these are the eyes, of course. So on the level that we can see the caribriform plate of ethmoid, this one, we can also see important structures like the medulla and the cerebellum. So this is the first thing. So when we can see the caribriform plate of ethmoid here, which, by the way, from it past the olfactory nerve, above it there is the olfactory bulb, and gives the innervation to the nasal cavity and makes you smell. Okay, so yeah, on that level, on the level of caribriform plate of ethmoid, we can see the cerebellum and the medulla. Okay, on this next picture, we can see what this thing in the middle. Before we talk about the structures, what is the key feature about this picture? How we know which level this is? We check a structure. This thing here, now the caribriform plate of ethmoid is finished. Here we have the vomer bone here. Okay, and this is the beginning of the formation of the nasal cavity, and later on it becomes the nostrils and everything. And still we have the eyes, but some other things are present here. It's the greater and lesser wing of sphenoid are still present, but this is not the main thing, not the greater and the lesser wing. The main thing here is the vomer. We can see the vomer here. On this level that we can see the beginning of the vomer bone, we can see the temporal lobe, this one, and here we have the other temporal lobe, and here we can see the pons. Next point here, we have the fourth ventricle. The fourth ventricle, we can see it in which level? In this picture, we can see, before we can talk about the fourth ventricle, we can see in the front these two sinuses. These are the two frontal sinuses, which are unequal in size. You see, this one is small and the other one is big. And the eyes started to disappear. So on the level that we can see the two frontal sinuses and some other things, which are the greater and lesser wing of sphenoid. We can see the fourth ventricle. Here we can see the fourth ventricle. Okay. The next point here, we have the suprasellar cistern. The suprasellar cistern appears when the greater and lesser wing of sphenoid disappear, but still the frontal sinuses are appearing. So it's important to check that. So we can see the suprasellar cistern when we have the frontal sinuses, but the greater and lesser wing of sphenoids disappeared. Next up here in this picture on the left, we can see the third ventricle. We can see the third ventricle here in the middle when the frontal sinuses started to disappear and decreased in their size. You can see that the size here is big, and here they started to disappear and they decrease in size already. On the next picture here, when we go farther, we can see also cryotrigeminal plate cistern. Well, of course, you can see that in the picture on the left, but he just wanted to show it in another picture. So it's basically in the same level currently. But yeah, you can see here the lateral ventricle, two lateral ventricles here, and there we have the quadrigeminal plate cistern. Okay, now we go to this picture, and we can see on this picture the beginning of the frontal lobe here. This is the frontal lobe here, or here we can see it also, and here we can see the parietal lobe. Okay, and of course these are the lateral ventricles, but they appear quite bigger, and yeah. So this is how we actually read the CT scan. We need to identify which level is the CT right now. Which level is it showing? Once you know which level is it showing, you know which structures you are looking at, whether it is medulla, pons, or all these things. Okay, so it's important to know which level we are looking at. So yeah, so thank you for watching, and yeah, I hope you enjoyed it. Please don't judge me, it's like my second video, so yeah, I hope you liked it and it was beneficial for you. Thank you for watching.